Well, today is the 19th of March, just a couple of days after St. Patrick's Day. And my name is Lynn McWright. I am here with Teresa Walding. Can you hear us, Susan?
Yes, I
Okay,
can.
great. We have our program is called Advancing Nurse Coaching, and we're here to help answer questions about nurse coaching. I'd like to just give a little bit of background about myself. My background is that I'm adult and geriatric nurse practitioner, went to school at the University of Minnesota, and now reside in Texas. Our school is just 10 years old, and we have a wonderful national corporation that backs all of the nurse coaching programs, the American Holistic Nurses Credentialing Corporation, that is also located in Texas currently. It is magnet recognized, and we are bringing people into what we consider to be the leading edge of our profession. So it's most of us, not all, most of us are finding ourselves in locations beyond the bedside, beyond the hospital. Some are still in the hospital working in various roles there, leadership and management. But what we're discovering is, because nurse coaching itself is so new, only 13 years altogether, we are really spreading our wings and finding out where nurses can be in all of our environments nationally. So here's Teresa to tell about her background.
So I'm Teresa Walding, and I've been a nurse for 30 some years. My background is all the things like most of us went through: ICU. I did skilled nursing. I opened a geriatric psych unit. I worked in post anesthesia recovery, home health, and entrepreneurship. So kind of made the rounds through there, and have loved everything I've done. And I think right now, for where we are in nursing and where we're headed, as far as I can see, is nurses want more. We want to do new and different things. We want to spread our wings, expand our skills, and we really want to be able to impact the health and well-being of the people that we serve. So that's how we came into nurse coaching. It was a brand new certification about 10 years, 13 years ago. And when we saw the potential of nurses being able to really take ownership of our profession and show what nurses can do, we decided to become nurse coaching continuing education providers that allow nurses to sit for board certification. If you have questions about that, we can certainly answer the details of how that came through American Holistic Nurse Credentialing Corporation and American Holistic Nurses Association. So we have a lot of really good people behind us who have paved the way for us, and now I think nurses are ready, and here we go. Hey, Robin, welcome.
Hello.
You found us.
I found you. Thank you.
Yeah. So that's where we find ourselves today. You know, the opportunity here is to ask your questions, see what's here for you, and your next steps, what you would like to do with your career, or what inspired you to come to this call.
So I'll just introduce myself also. I'm Susan, and I've actually been a nurse over 40 years. I got my 2-year degree, so I was a nurse when I was 19.
Wow.
Done a variety of things too, the med-surg route, NICU, office work, teaching. I've been in academia the last 18 years, and I teach pediatric nursing, and I became a holistic nurse. I'm trying to think how many years ago. Anyways, I'm certified as a holistic nurse, and I'm just kind of looking at what my next step might be. I mean, I'm kind of looking at retiring sooner than later. I might take a sabbatical and was just kind of looking at nurse coaching as a certification that maybe once I retire, that might be something I would like to do. So I'm kind of searching.
A lot of people find themselves at that place, and we absolutely want to utilize and amplify everything that you've learned all throughout your career in nursing. So nurse coaching is totally open to that. We're actually open to every clinical area, every age group. There are no restrictions on coaching. Every nurse can apply coaching in her work wherever it is, or have that be her work exclusively. Susan, Teresa and I really feel that nurse coaching is not only the most important thing that has surfaced in regard to promoting health, but also that for ourselves as nurses, it's not only the least demanding on ourselves physically and mentally, but it is also at the same time the most rewarding.
Yeah. I think it's really interesting the ways people are showing up now that are coming to want to learn about nurse coaching or becoming nurse coaches. They already have ideas about what they want to do. Do you have an idea of what sparks your interest or is attractive for you about thinking about nurse coaching? Or
I think to me it's kind of an extension of my passion for teaching. I think it's a way that I could continue to, and I know coaching would be different than teaching, but I think just my passion for helping people through education. Um, I think as nurses, we do a lot of that already, probably, but this would be a more formal role in that way. And it comes up a lot in all of my reading for my continuing eds for a holistic nurse. You know, it comes up a lot, and so I was just intrigued and thought I would hop on and see what everybody's doing and how you're enjoying that role.
yeah, it's great. And it's true. Margaret Erickson has been very instrumental in American Holistic Nurses Association as well. So that's why you see um, that compatibility of being able to support holistic nurses and nurse coaches. She actually offers both exams and so that's how that comes together. Um, and I think you're right. You can be an educator as a nurse coach
Mhm.
because people want knowledge. There's a lot of
Right.
people who don't understand, their medical diagnosis or the health and well-being side as far as prevention. We have a few nurses who were into the pediatrics and then realized they really wanted to work with the parents because that's what influences the children and
Mhm.
with nursing knowledge. So if you can
Right.
dream it, you can create it, right? And who knows
Right.
better than a nurse who understands what it's like to live maybe with a child with medical problems or even
Mhm.
what you've learned through years of just being with that patient population.
Mhm.
And maybe you have other aspirations. I don't know. Maybe there's other places you'd like to go. But very cool.
I know I have a daughter right now. She's an occupational therapist and actually certifying as a sleep coach. And that's been really interesting to me too. She's just finishing that right now. And that's kind of a really interesting role that she's going to be transitioning into. So yeah, I'm just kind of at the exploration stage.
Wonderful. Okay. Well, great. Miss Robin, nice to
Hi,
see you. How are you?
it's been a while. Good.
It has. You haven't changed at all.
She's traveled the world since we saw her
I
last.
know. I know.
I love traveling. I was going to tell her I'm also a nursing instructor. I use what I've learned from them, and of course from Judith Beck from CBT, both, and they've been wonderful with helping my students and helping my students actually grow as nurses and teaching them how to have a conversation and letting them practice with patients is great. So even I'm one of those SODO 2 instructors, see one, do one, teach one. So I love using my coaching for that.
Yeah.
We really feel that coaching is the leading edge because where we're at is allowing ourselves as the provider to walk alongside the client, not in front of, not telling them what to do, because that never worked, but simply walking alongside them and letting them guide us to what their goals are. And in that way, they do the heavy lifting. It's not on us to see that we're not accountability partners for them. They are on their own. The ball is in their court. It's their goals that they're working toward. And we're simply there to help point the way, but also to support them on their journey.
You know, and as far as coaching and teaching goes, you know, we all love that moment when the lights go on, right?
Mm-hmm.
And that it's kind of like, they got something they didn't know they needed to know. And that truly is, as far as I can tell, the best way that we learn. In our program, we
Mm-hmm.
call it through insight. Like they finally got whatever it was there for them that made sense in their own mind. And that's the position that we come from, is that the wisdom is already there. We just sometimes need a guide, we need a conversation, we need someone maybe with a little more life experience or knowledge than we have. And that's not an age related thing. It's, you know, we've all traveled a little bit different path and know things that not everybody knows. You know, my daughter was, she was laughing the other day. She's like, you know, you're raised by a nurse when your friends ask you questions about their health. It's like,
Yeah.
you know, because we have been teachers our whole lives. So our children even know more than the general public, but it looks normal
Mm-hmm.
to us. Nursing knowledge looks normal to nurses and sometimes their family members, but we forget that the public doesn't know that.
Yeah, why would you clean a
Mm-hmm.
wound before you put the Band-Aid on? It's just easier to put the Band-Aid on. It doesn't have
Right.
to be cleaned
Yeah.
wrong.
Right. Right.
So it's such simple things as that we can really help the public see for themselves how the smallest acts in our daily lives truly influence our health, let's see, health outcomes for decades. And
Mm-hmm.
it's once again, as Teresa said, little known. And it's for us, it's like the back of our hand. We know everything, well, most everything that needs to be established for just conventional healthcare today that can be proactive. I mean, this is, in my sense of things, health promotion at the highest level,
Mm-hmm.
because we are working with what are potentially already healthy people, and they can go another step farther. Actually, now that I've said that, the um, American Association of Nurse Practitioners put out an article, and it's been some time ago, it was 2018, but what they found was that the number one need for nurses who coach is in the area of stress prevention, resolution. And beyond that, the second area that was largest, chronic illness, which is taking such a toll on our healthcare system, not only nationwide, but worldwide. I mean, it's the biggest expense that there is in healthcare. And then the third being pain. So those three areas have been traditionally where nurse coaches have worked: the stress, chronic illness, and pain. And we don't even want to call it chronic illness. What do we want to call it, Teresa? Metabolic imbalance.
Yeah. Yeah. It's interesting that we have to loop it into all the things that are wrong with us, right?
Yeah.
And I sometimes kind of can't we just talk about what's going right? The wellness piece of what we're doing that's actually helping us and working for us. And I think we're just geared to look for the things that are wrong. But I think in the health promotion and prevention, we have to look at what's going right. You know, we're
Even your sleep therapy. I mean,
yeah.
that just sounds wonderful because Americans are just notoriously under rested. And what a better place to start than that. Once people are more well rested, I'll just make this up, they'll be able to see for themselves that they may want to take a walk. They may want to add vitamin C to their diet. You know,
Mhm.
there are all kinds of things that they will be able to see for themselves when they're feeling better.
So I was wondering, like in my daughter's the route she's going, hers is just pediatric also, which is really interesting. She's
Wow.
actually been coaching. She has a 8 month old and her
Mhm.
our son live out there and they have an 8 week old and they were having a lot
Wow.
of trouble and she's been coaching them and both the girls sleep 11 hours at night. Like it's really been fun to see
Oh,
even
Wonderful.
the difference in
nice.
our own family. And then she
Yeah.
had to take on she had to do an infant, newborn, and toddler, I think, for her practicum. But I was curious, like in this role with nurse coaching, is that your primary job? Is that something you're incorporating into a clinical job you have? Do you do it online? What does that look like? And maybe it looks like a lot of different things, but
So in our program, we really work on mindset, understanding how our thoughts work and how it directly impacts our health and well-being. Because the number one cause we have is stress, right? Well, where does stress come from? Stress comes from our thinking, and we never look there. We look at it as our environment and our circumstances. And so in our program, we really point to really how thought works and why that impacts our health, our well-being, and the things that we do in our life. So does that answer your question? We really work only from that point right now because it impacts everything you're talking about. Our
Well,
I
but we
physiology,
was
work
just,
our
online, we work by email, we work,
yeah.
we can, it's, we're just creating this now. You are an absolute pioneer even to be on this call today. Um, One of our colleagues created a system where she is working with large corporations and they're paying her through the HR department and she coaches the employees. The employees don't have to go to the doctor to have their questions answered. The employer is thrilled that the employees are at work. They're not leaving work. They're contacting her instead. If she gets real busy, she hires other nurse coaches. So it can be, you know, as big as that, and it can be as small as just literally putting a shingle on your door and saying that you're opening your business as a nurse coach. You have to let your city know, but beyond that, we okay. So all that is required to become a nurse coach to take the certification is to have an active license, unencumbered, and 2 years of experience, 60 hours of continuing holistic nursing education, and 60 hours of coaching.
the 60 hours of coaching, is that something then that a person pairs up with someone who's certified as a coach? And
We supervise those coaching hours in our program. There's no extra cost to it. It's already included. The way that Dr. Erickson has it set up for people to begin is we match the student with another student and they do their first 4 hours together. And then beyond that, they recommend, she recommends 8 people,
10
10,
people 3 times.
8 people 3 times, but it doesn't have to be that. It's just the recommendation.
okay.
I did several of mine with a group, let's see how to say that. All of my coaching that I did was one-on-one, but some of our students, for example, the ones that are diabetes educators, they'll have 10 people in a class and they can count what they're already doing at work as their coaching hours.
Okay.
So it's a variety. Some people pick up their friends from Facebook. Some people coach their families. Sometimes students trade friends and families, so they're not quite so close. And church groups, there's just any number of ways that people find volunteers, and because they are volunteer hours, they don't have to charge. People who already are in practice for themselves, and we've had several, can bill their regular rate and do their practice coaching at the same time. And I think didn't you do some students, Robin? Weren't some of your students your coaches?
Yes.
Yeah.
And honestly, we have a great need in our student body. I think maybe things are a little better since COVID, but like the anxiety levels are so high among the student body, and personal issues. And I had a young lady I met with today after simulation, and some of her assignments are turned in partially done, or she misses deadlines. And she finally shared with me in an email that her dad had passed away. And, she hadn't said anything to any of us. So I met with her today just to be able to talk one on one. I don't always like email for those conversations. And it ended up her dad had died last semester of pancreatic cancer very quickly, but she hadn't really taken any time for herself, shared anything. So it's things like that that I see even a need amongst our student body of, um, how to get through some of these situations, how to handle their anxiety.
This program really does address that very much in depth. And the interesting part about our program is the first 2 courses are for you first.
Okay.
Because when you get to see your own thinking, your own way of showing up in the world, maybe some of your own patterns and how life works, it's easier to help people through those kinds of circumstances.
Mm-hmm.
And when the most important part of the nursing coaching conversation is the nurse. You
Mm-hmm.
hold the presence, you hold the intention for their highest good, and you listen. We listen with as little on our mind as we can to truly hear what they're saying. Because when you hear yourself in that way, you get more clarity.
Mm-hmm.
And sometimes you don't even know what you've done for someone. But that piece of being heard and understood does a lot for people. It gives
Mm-hmm.
us a different come from. And it doesn't come through a modality. It comes through the actual listening and asking the question that occurs during that conversation. And a lot of people don't teach that particularly. But what we've found is sometimes we ask a question and we're like, why did I ask that question? And the person that's
Mm-hmm.
receiving it truly does go, oh, that was a really good question. So we trust the process, the intuitive parts of us. Nursing likes to call it informed knowing now instead of intuition. But
Mm-hmm.
I think that's the beautiful part of what we do is holding that space for each other and for anyone that comes to us for this kind of conversation.
Mm-hmm.
The official book is entitled The Art and Science of Nurse Coaching. And the very first edition, it's in the second edition now, but the first edition was written by Darlene Hess. And we had her as a speaker recently at our local holistic nursing chapter. And what she's told us at that time was that nurse coaching is a very highly honed skill. When you're listening to your internal knowing at the same time that you're listening to the client. And, there have been books and books written about important questions to ask in a coaching situation. But it is just as Teresa says, the only question that's important is the one that arises in the moment when you have your chemistry and the chemistry of the client working together in relationship. That is what creates a therapeutic relationship.
Mhm.
I
So with
suspect
this
you noticed that.
So with the program, I know when I became a holistic nurse, I just studied on my own and took the certification. Our program, we are one of the universities that has an endorsement. We're actually doing our re-endorsement right now, myself and one other faculty.
Wonderful.
So yeah, it's been amazing. I absolutely love it. Um, so our hours were pretty much waived because we were in a holistic program. So for the nurse coaching program, is it a more formalized program? Is it like study on your own? How does that work?
So two things. One, first of all, are your students aware that they're eligible to sit for the holistic nurse exam when they complete their academic coursework?
Oh, absolutely. Yeah.
Okay,
I actually, in addition to being a pediatric clinical instructor, I teach a high skill level lab. And I've actually woven in a lot of holism. We're redoing our curriculum right now, and I end up with a lot of holistic um, standards, but I was already doing a lot of that. And so I always remind them, I have them at the junior level in peds, and then I have all the students at the second semester junior level. And so we definitely encourage that. We've been working with Anna to try to get a feedback from how many of our students go on to certify. We often hear from them if they need help, but we haven't had an exact count. So we're trying to get a better count to see how many of our students go on to certify. And one of my colleagues recently reached out, I think to Margaret, and asked, some of the feedback we're getting is that 2-year benchmark sometimes seems a little soon when they've gone through an extensive,
3 years.
maybe a
3 years. They can take those certification exam within 3 years of completing their coursework.
Oh, see, we've always been told 2, and my colleague reached out to see if that actually could be extended to 3. So have they extended it to 3? Because that would be amazing for our students. It just seems like 2 is a little soon.
Well,
Well,
I know on the nurse coaching that you have to use those CEs within 3 years. So you're
Okay.
saying that it's 2 years for the holistic. You have to use the
Yeah,
credit.
it has. Right, from graduating from our program, they have 2 years, and then they can't take advantage of having graduated from our program. And I know Wendy reached out, I think it was to Margaret. So the last I heard, they were checking. I think it probably has to go to the board to see if they are willing to extend it to 3 years, to see if we can get more students to do that certification. We had some feedback from a new faculty member that had one of the first nurses at her hospital in a different city go for the certification. And she said, 2 years comes up really quickly when they've just gotten off maybe an extensive orientation. They're trying to get their feet under them. Um, she said if it could be just a little after 2, she thinks we would get more nurses to certify. We also just were accepted to participate in the ANA nursing pilot program for bringing students on board. You're probably familiar with that. They're giving them a reduced rate of $25 to join, and then they can work towards an honors course. So we're super excited about that. My daughter, I think, is going to be probably our first student. She's a senior,
Wonderful.
and they're allowing her to claim some of the things she's done the last few semesters because the seniors didn't have enough time. So we're super excited about that. I talked to a nursing student at a Sigma induction yesterday, and she is first semester senior, and she was telling me she's already signed up and already starting to look at what she needs to do. So I think that that pilot program is going to be really helpful of
Wow.
just continuing to bring this forward to the students and get them involved earlier on. So I'm super excited about that.
That's
right. Oh,
wonderful. I'm
great.
so glad to hear
Yeah.
that. Wow.
Yeah. Well, and thanks for looking into that because we need to know that too, Teresa,
Well,
very,
I
very
thought
much.
it was 3 years because that's what
Yeah,
it is
because coaching is
for the
right.
CEs, but I didn't know the holistic nurse was different.
Our
Yeah.
course that we offer here online is also offered through Texas Wesleyan University, and they do it in 16 weeks, and it's 3 academic credit hours. They do have to
Okay.
test within 3 years of completing their academic hours, or for us, those who are working with us online, it has to be within 3 years of completing our course. So
Okay.
that's what it is for coaching.
And then what would the online program look like?
Well, we have 4
Um,
courses. As Teresa
okay.
mentioned, the first 2 are focused on the nurse herself. The tenets of the holistic nursing, the first tenet being taking care of the patient as a whole, body, mind, and spirit. And secondly, alternative modalities as appropriate. But the third tenet really is taking care of the nurse first. And we don't hear that in conventional healthcare. So that really is the place where holistic nursing stands out. I think it's interesting that holistic nursing was the first to write their scope and standards, and the ANA read the scope and standards and essentially copied that for themselves. So now the ANA says all nurses are holistic. Well, there are varying degrees of holistic, but
Right.
so, it can be integrated into conventional healthcare, but it may not be practiced holistically. So, but your earlier question was about the 60 CEs and the 60 coaching hours. Um,
Yeah.
there is a list of coaches online on the AHNCC website that if a person prefers only to do their 60 hours of coaching and 60 hours of CE, they can get a nurse to supervise their coaching hours. Um, and Margaret had to do that because that's the way that the holistic nursing is set up. You're not required to take a holistic nursing course. The problem there that we see is, how do you learn to coach?
Right.
So but the short answer is, it's not required. You can take the test with only 60 hours of supervised coaching and 60
And
hours of CE,
Okay.
holistic CE. But the people that I've known who've done that have actually not been successful in getting their certification. There may be people who have, I just don't know them personally.
Yeah. And I mean, I'm actually looking for a more formal program, to be real honest. I would be interested in that. Is that something, if I'm awarded my sabbatical in a year, is that something that I can sign up through, right through the HANA site?
It's only through
Like for the program or,
yeah, right now there are 7 schools of nurse coaching. They're all privately owned. So they're listed
okay,
on the ANA site and they're clickable, but it
okay,
would have to be signed up individually on the private school's website.
okay.
There's
I
one in,
know I was looking at doing just, I'm sure it's a simple one, just, we always are awarded education money and I don't know how many CEs it was like $350 to do this nurse coaching. And I figured it would be kind of an introductory to all of that. Nothing like this, I'm sure, but I think that was probably affiliated with Anna too. So there's 7 schools on the website, on the site. Do you have a recommendation? I would be doing it online. Do you have a recommendation what school, or if you're not comfortable with that, that's fine. But out of those 7, is there a program that you feel maybe is like one of the better ones or
well,
has had a good success rate?
we were the first group to be online. So when the pandemic came, everybody else went online also. So we have been online the longest with advancing nurse coaching, and nursecoaching.com is our URL. There is also a school in Canada, and they incorporate holistic nursing and nurse coaching together in their coursework. I don't know of any program that is $350. And my sense of things would be that it certainly would not allow one to become a certified nurse coach through AHNCC.
Right. Yeah, I
There
was
are
sure it wouldn't.
lots
I
of
was looking at it
coaching.
as just like an exploratory.
Well, there are lots of coaching programs out there. And, if you're a physical education major, you can take a coaching course, memorize a blood pressure, and hang your shingle. There are no legislative bodies over the occupation of coaching. So
Okay.
for nursing, the most important word in nurse coaching is nursing. You're a nurse first. We are required to uphold all of the requirements of our licensure, our scope and standards. The life coaches are not put to that same standard.
Right.
Yeah.
And our program actually is a formal program. We have 4 courses.
Okay.
They're self-paced. We offer the continuing education and the coaching supervision. We have a video series in each course, about 10 videos. We have 3 live coaching calls where we talk about the material in the class and coach during class for experience. If you're further along in the program, you can coach other students. And if people are fairly new, we coach them. And then we have student advising, which are individual or small group, depending on how many people are in the coursework. So there's 5 opportunities per course to have interaction and continued guidance on the coaching skills. There's the 5 core competencies that are on the website, and then the 12 standards of practice, which we're responsible for as a nurse.
And those are what the test is based
Yeah.
on, the exam, the nurse coach exam.
So that was a roundabout way to talk about that, but yes.
Boy, it really was. Wow, sorry.
I think she disappeared.
I think y'all still do the weekly meetings too.
It's weekly
Yeah.
meetings, and you can come for as long as you want. 3 are required, but we've had a lot of people that came to many more classes just because they wanted to be in the coursework.
They're so inspired. Well,
Mhm.
and now we've added another time frame also. We generally, for a larger course classes, we meet on Wednesday night at 7 Central, but we've also added Monday night at 8:15 as another option, especially for West Coast people. But anybody is welcome to come.
Yeah.
Yeah. So our students are required to attend 3 of the weekly calls, but they can attend as many more as they choose to. And most people choose to do more. Susan,
I lost you for a few minutes, but
yeah, you looked frozen.
yeah, I did. I lost you for just a few minutes.
We can
Is there, well, I was wondering too, if there is a way, and maybe it's on here, maybe I missed it, but I don't know if there's a way to go into your program and, look at the things step by step.
Oh, she went mute.
Is our curriculum visible on the website?
We have the not inside the coursework, but there's the details on the website. Susan, I don't know if you can hear me, but I dropped the link in the chat. There, she's back.
So it's in the chat, Susan.
Okay, I think I'm back again.
Okay.
Teresa dropped the link.
Yeah, I'm going to drop the course descriptions in the chat for you, not just the website.
Okay.
That way you can look at it, and I'm happy to go through it with you on a call if you would like. That way you can see a little bit more. So it's the second link that has the course descriptions.
Okay. I'm logged in on my phone. Let me see if I can, I want to make sure I can capture this.
Okay. Would you like me to text it to you or email it to you?
Could you, could you email it to me? That way I'll have it in my work
Yeah,
email.
because otherwise you might.
Okay, it is coming up. It is coming up here, but if you wouldn't mind just sending that link to my email. Whoop, I'm sorry.
Do
I'm
you
using
want
my
to type
phone
your
here. I should have
email in
logged
the
in on my
chat?
computer.
Yeah, if you type your email in the chat, I will send it to you.
Okay, let me go back here. I'm on my phone and I'm not as great at doing this on my phone. Okay, let's see. Type here to chat. Okay. How long does it take most people to complete the training? I know probably the practicum is up to how soon you schedule people, but how long would you say
Right.
most people take to complete it?
I would say 6 to 9 months. Some people take
Okay,
12. Just life gets in the way. People
right,
start like, I'm going to do it in 16 weeks. And then what's very interesting is people are like, oh, I'm not ready to leave the course yet. So they take a little bit longer because they're getting healing for themselves that they translate into their practice. And then they're like, okay, now I'm ready to coach. And so that's kind of the
interesting,
transition that we've been seeing with a lot of our students is it just feels good to be with a group of people who care about you and want to be a part of the evolution of nursing and truly be a part of your life for however long you choose. And that's one of the places where I think we really want people to know that this isn't just come take this course and we'll see you later.
right,
We want to see you thrive and come back and ask questions and stay connected. Like
Building.
Robin, we've known for quite a long time.
Mhm.
And she came back to see us today, so I'm thrilled. So we have quite a lot of people that just want to come back and say hi, and that's the community that we're building, a larger community outside of the program itself, where if you want to do something in nursing or coaching, you can find somebody who has your similar interest, and we still want to be there and be part of that conversation.
right. No,
So
I love the time frame. If I took a sabbatical, it would be for 2 semesters, so that would be very doable. I just don't want to try to do it with teaching. I'm already so, it's just such a heavy load, and there's just no time. So I knew that I wouldn't want to do it while I was actively teaching. So that time frame is great.
I can tell you that the way we've structured this course is totally experiential. You don't have a lot of book work. You have to read the book, but we
For
don't
the
teach out
test.
of the book.
Yeah.
And we don't have a bunch of tests that you have to kind of regurgitate knowledge. You take what
Okay,
you learn and you use it that day or the next day, and you have insights of your own and you use them as your own and you coach from that place. So as far as time commitment, it's it's whatever you want it to be. We've
right.
had a recent 2 students who have blazed through all the videos and have said, I wish I would have known this sooner. Because they're going through a lot of life circumstances. And
Yeah,
now they're taking the classes and they're showing up every week on all the classes. I know that they've completed their required time, but they're healing at the same time as they're taking this program. And
okay,
that is a beautiful thing to see. And I know they will be successful because we're here to support them. They've got people around them that support them. We don't have to do this alone anymore. Most of us kind of feel
right.
like we're our own, oh, I have my nursing license and now I'm on my own way, even if we're working somewhere. I think we're ready. I think as a profession, we're ready for more. And so those of us who are interested in health promotion, prevention, and even chronic care, we want to live our best life. I don't know anybody who doesn't want that.
Right.
So
Susan, I really always recommend that people begin as soon as possible. Just tiptoe in and have a look around at some of the videos. The information that you'll glean from even the earliest videos and having access to our pamphlet is called Why Are We Not More Resilient? is life-changing for a lot of people.
Yeah, we talk about resilience so much at school with our students too.
Well, we have a new definition of resilience, and when we were in California last week we were speaking to the California Association of Nurse Practitioners. They said, why don't you have that all over your booth down in the exhibit hall? The new definition of resilience in our course is resilience is not being bound by circumstances or the past.
I like that.
Complete freedom.
Mm-hmm. Yeah, that's good. I like that. Well, I never expected to have a one-on-one. So
Well, a
it's
one
been
on
great.
two, a two on two.
What, yeah, 2-on-2. Oh,
You know,
Yeah,
a
this
lot of
has
people
really been
sign
fun
up.
for us.
We had quite a few people sign up, but they plan to watch the replay, you know,
oh, okay.
because, you know, it's 1 o'clock on a Thursday, so not everybody could come.
Yeah,
Right.
time
Um,
commitments.
Yeah. And that's the beauty of our program as well. If you have to miss something, you can. Like
Right.
there's not a thing where it's like, oh, if you miss it, you're done.
Mhm,
It's not
mhm.
like that.
Right.
We are in real life with real things that are going on, and we can learn at any time. So
And the
it's
online just opens things up so much more too.
Right. So we have actually rolling enrollment. You can sign up anytime, and
Okay.
and the course is completely self-paced. I know our academic students do it in 16 weeks, but it is completely self-paced.
Okay.
And we do have a new offering if you want to just tootle in slowly. The first two
Uh-huh.
courses we're selling for $9.99 right now, $997, I mean. And you can come in and do those first two courses without worrying about the coaching piece,
Just the videos.
just the videos.
Okay.
So that's an option if that's of interest to you.
Okay.
I haven't even checked the website. I know our webmaster said it was
It's
up
there.
yesterday.
It's there.
Okay, great.
We're trying to meet people where they are, because a lot of people are saying, I just don't have time for one more thing. But we have to take time for ourselves.
Yeah, we've had, conversations with nurse practitioners over the last couple of weeks, and they all end up saying, I need help. So we're calling it the Nurse Reset, those first two courses. The first one is actually called Essentials, and the second is called Understanding. So we know what the essentials are, and when we understand ourselves and how our thought works, then we can move forward with our career, with our coaching, with knowing how we can help others. But until we understand ourselves, it really is not possible. We're pouring from an empty cup.
Right.
And the price of those two courses apply to the full course.
Okay.
So you don't lose anything.
And you said there's 6 courses altogether, is that right?
4. There's
Or 4. Okay.
There's,
Okay.
yeah, C101, 2, 3, and 4. 101 and 102 are for the nurse, 103 and 104 are for the coaching piece.
Okay.
60 CEs.
Yeah.
Okay. I did get that.
Yeah.
Well, it's wonderful that you've got the background of being familiar with our holistic nurses. That's great. Yeah,
Nikki has
Yeah.
quite the reach.
she does. Yeah.
Yeah, we have 5 holistically certified faculty members, and we're trying to get some of our younger faculty certified too, so that we make sure this program continues to go forward.
Oh,
Um,
let them know about our special offer that just started yesterday.
okay.
Yeah, that would be a wonderful beginning. And then we did a conference in 2018 that had 5 hours, and we can add that to it. So that would be 45. You have to have 48 hours CE. And then Teresa, we can add what you and I and Keith did on the 2020 conference, and we'll have the 48 hours.
Yeah. Yeah, we could. Well, did we answer all your questions? Is there
You
still some?
did.
Okay.
No, I've got
good.
a bunch of notes. It was very, very helpful. I'm excited about it. I'm gonna, like you said, just kind of poke around on the site and look at things a little bit more. And yeah, I really just needed to get an idea. So when I write for my sabbatical, I have some good information,
Yeah.
what that looks like. So yeah,
Yeah.
this has been great.
Thank you so much.
Thank
And
you.
Yeah.
Robin, any
started-
last words?
Well, I was just going to say we did start a collaboration of all of the nurse coaching programs. We started that in 2019. So we all get together on a quarterly basis.
Oh,
So
nice.
we're all on the same page. You know, it looks like we're all competitors, but really we're collaborating. And, you know,
Good.
moving nurse coaching forward is exactly the goal for all of us.
Right. That sounds great. Sounds like a wonderful network.
Yeah.
It is. It truly is. Yes. Yeah, we've got each other's backs, and that's what all of nursing is go, I think we're going toward that now, but there seem to be a few gaps in the way currently. Nurses having each other's backs, and the institutions that nurses work for having the nurses' backs. Well, Robin,
Yep.
any last words from you?
Just good seeing everybody. It's been a while.
Oh,
Yeah.
wonderful. Yeah.
We're really glad for you to be here.
Well, enjoy your world travels, Robin. I enjoy seeing you on Facebook.
Yes, I do too.
Thanks.